Well, good afternoon again, everyone. My name is Ebony Johnson, and I serve as the chair for Community Health Planning and Policy Development section. And we would like to welcome you to our 2022 Town Hall meeting. We're so excited that you could join us this afternoon. Next slide. And so we have a pretty robust agenda for you this afternoon. We're going to start by just giving a quick welcome. We are family. And so we always like to start our events with just a hello. Where are you from? And I see that many of you have placed that in the chat. So thank you so much. From there, we were going to introduce our leadership team. We'll talk through some of our recent section activities. We are a busy section, so we want to ensure that we can provide an update on where we are and what we're doing throughout the organization. From there, we'll talk about our upcoming activities for the year, which will include some events that are wrap out this program year, and we'll talk about our annual meeting. From there, we'll have an opportunity to talk about different engagement activities, and this will give you an opportunity to learn more about how you can be more involved with our section. And then finally, we'll have an opportunity at the end of this town hall for everyone to connect with one another in a social setting. So we'll have some breakout rooms set up. At that time, we'll stop recording. And again, you'll have an opportunity to connect with your fellow section members across the country. So before we get started, we want to do a little connection activity. We love to learn about our section members. Again, we have a very diverse section with over 4,000 members. So one question that we love to ask is, how long have you been a member of CHPPD? And so if you can see, there's a poll. So if you could please select the number of years you've been connected with the section. The first question again is, how long have you been a member of CHPPD? And then the second question is, which role best describes you? Are you a student? Are you an early career professional? Are you a full-time professional? Are you transitioning? Or are you retired? Or are you working in public health in some other capacity? So we'll give about 2 to 3 minutes to do our poll. We also have one other question that's attached to this activity. Question 3 asks, what area or field are you coming from? And so there were different choices of academics, government, foundation, community-based, advocacy, private sector, the health system, or others. So again, we'll give a few more moments for folks to respond.
And I feel like we have reached capacity. We have 90% participating. We're participating in the poll.
So Maurice, I do see in the chat that there are a few folks who don't have access to the poll.
You know what? I'm going to, you know what? They might have joined while we're in the middle of it. So if they can answer to the questions in the chat, if they haven't had a chance, because once we launched it, we would have to get them, we'd lose a response we've gotten this far.
Okay. So for those who do not see the poll feature, if you can respond to the questions in the chat, that would be great.
And let me click end.
Okay. And it looks like we have quite a bit of members who are new to our section, with 42% being less than a year or new to our section. About 32% of us have been with the section 1 to 2 years. 11% have been with the section 3 to 4 years. We got 5% that are 5 to 9, and so excited to know that there is 11% of our membership that has been with the section for 10 or more years. Outstanding. Question 2, which role best describes you? Looks like the majority of our attendees are full-time professionals at 53%. We have about 11% that are students, 11% that are early career professionals, about 11% that are transitioning. We do have some retired members in our section, so congratulations to you on all of your accomplishments throughout your career. And then we have some that are in other fields as it relates to public health. And then our last question is, what area or field are you coming from? Looks like 37% are coming from academia, about 16% from government. I did not get a chance to answer this question, so I will count myself among the foundation and funders. We have about 5% that are community-based organizations, a small non-for-profit, 11% that are advocacy, 5% in the private sector, 21% that are in the health system, and then 5% that are in other fields that represent public health. So again, thank you so much. As you can see, we are very diverse. I want to do a bit of context setting for those who, again, are new to our section to learn a little bit more about who we are. So what exactly is community health planning and policy development? As a section, we influence the design of health systems and policies that are responsive to a changing society. And I think that, there's no more better illustration than the resiliency of our public health community during the pandemic. We bring together technical information and the expertise of communities, health professionals, business, and government. Next slide. The mission of our section is to develop and advocate for health planning policies and practices to promote health equity, community empowerment, and social justice. Our vision is to create a dialogue and action nexus for community health and policy leaders. Again, our community is very diverse, as we saw from our poll. We come from all parts of the country. Our membership is now over 4,000 members. We have a global influence. Our members span about 45 out of the 50 states and over 39 countries. And I am most proud to share that our longest active CHPPD member joined in 1940. So again, we have a long-standing commitment to the vision and the mission of our section. And as you can see, our leadership team is just as diverse as our membership. And again, we come from various backgrounds within public health and across the country. And so this picture here represents individuals who serve in various capacities throughout our section, and you'll get to hear a little bit more about what we do and be introduced to some of these leaders a little later on in our town hall. Next, I would like to go into some of our recent activities. For us to be in a pandemic, I'm very proud to say that our section was very, very busy. So through 2021, we had a lot of great activities that not only spoke to what we did as a section, but also activities that helped to foster engagement with our students and early career professionals, and also bridge the gap in terms of networking for our full-time professionals, those transitioning, and our retirees. So just a few events that we curated throughout the year. And these in particular were events that happened during our annual meeting, which was in Denver last year. We had a webinar which was hosted by our immediate past president, Dr. Brian O. Buckley, on how to navigate the annual meeting. For those who have attended the annual meeting, it can be a very daunting experience. So we were very excited and very thankful to Dr. Buckley for his tools of wisdom on how to make the most of your experience during the annual meeting. Last year's meeting was a hybrid, so we offered activities both for those who are meeting in person and virtual. So we actually had an opportunity for those who attended the annual meeting in person to do a meet and greet at our section booth in our expo hall. We also had a student and new member meeting, which is always exciting to me. We have some very bright up and coming public health professionals. So I always enjoy the opportunity to meet students and meet early career professionals just to hear more about what's happening in the public health space from their perspective. We also had our section business meeting, and in our section business meeting, we get an opportunity again to share the activities that we've done as a section for a year, also to talk about where we want to go in the future. The highlight of our annual meeting is our day of action. And so we've been doing that now for over 10 years. And so this is actually our public service and our community service back to the communities in which the annual meeting serves as a host site. So in Denver, we actually had a very enriching discussion around public health for public safety. And then also another new activity that was a really great treat was our virtual coffee hour. We actually had an opportunity to talk to a barista about her experiences and her journey as becoming a barista, excuse me, and how the connection of coffee brings together social connectedness. So it was a very, very enriching conversation, and we were so excited to see so many of our section members participate in our activities. Another great component to our section is our fundraising. Your donations absolutely matters. And for those who know DJ Khaled, he's very prominent and very appreciative of all the things that people do. And we are appreciative of you for your donations and your charitable giving to our section. Your donations help to ensure that our students and our early career professionals, as well as our professionals, have the opportunity to attend the annual meeting. For some, the annual meeting is very cost prohibitive, but with your donations, we're able to offer scholarships. Last year, we awarded more than $3,500 in scholarships to students, early career professionals, and professionals to attend the conference either in person or virtually. And so we would love to continue that tradition as we celebrate 150 years in Boston. And so this year, our goal is to raise $2,022. Making a donation is easy. And so we have a QR code here. If you have your smartphone handy, I like for you to just scan our QR code. It's a one-step touch. You can make a one-time donation, or you can make recurring gifts. The association is actually making it very user-friendly for us now to be able to donate directly through the section again. And I did see some notes in the chat from some of our scholarship recipients. And I can say personally, as a scholarship recipient from 2018 in San Diego, those scholarships mean a lot. So again, we thank those who are able to donate, and we encourage those who have not had an opportunity to please support our section in that capacity so that we can pay it forward to the next generation of public health professionals.
I also want to add that there's a link in the chat. If you can't use your phone, you can click on the link in the chat. Kelly is helping facilitate our chat today. Thank you, Kelly.
Awesome. So we're going to take another connectivity break, and we want to learn a little bit more about you. So we're going to offer another poll, and we would really love to learn why you joined our section. And so the responses are: it aligns with my work or interest, professional development, previous abstract accepted by the section, networking opportunities, mentorship, or it just seemed cool. I think the section is cool. So I look forward to seeing your responses.
Oh, nice. We got 22 participants. All right, I'm going to go ahead and close.
Awesome. So it looks like the majority of our attendees today are with our section because it aligns with their interests or work. We have about 59% are with our section for professional development. About 5% previous abstract was accepted. 59% are with our section for the networking opportunities and collaboration. About 9% are here for membership, and the 27% just seem to think we're cool. And so again, thank you all for your feedback, regardless of where you are in our section. We are so delighted to know that, again, that what we do can fit your needs. I do want to say that if you feel that you are needing more, our doors are wide open, and we are always here to help navigate where you need to go as far as the organization and even in your career. So please feel free to reach out to any one of us. And again, when we go into our networking session, if you have questions about public health, if you have questions about navigating the organization, or if you just want to learn more about us, we're here and we're available for you. And so now I am going to turn it over to my wonderful and phenomenal co-host, Mr. Maurice Johnson. He'll talk more about our 2022 goals, activities, and engagement opportunities.
Thank you, Ebony. And please excuse if I look like I'm distracted, as I have 3 screens operating here, trying to facilitate this meeting while looking at slides. But I do want to have my camera up so you all can see me. Good afternoon. I'm glad you all could attend today. So yeah, I just want to share a few thoughts about what our plans are for this coming year, or not coming year, we're in the middle of it. Can't believe it's pretty much April tomorrow. And so let's dig in. So one is that our overall framework or our strategy is to align with APHA's overall goal for the healthiest nation. And they have a 3-pronged approach to creating the healthiest nation, which involves strengthening public practice, aligning organizational capacity and infrastructure, and building a public health movement. To align those things together, we believe that we need to apply a health equity framework in the work that we do, for the programs we apply, as well as for how we have are represented within our section. We look to foster opportunities for mentorship and professional development among our members, and we want to help bridge and connect folks to learn and have those opportunities. So events like today, various web meetings that we put together throughout the year through our health communications group and our student committee, the engagement that we do with our membership group, sending surveys and always enlightening or providing insight into the opportunities for engagement. We want to make sure that you feel that you can be involved at the level that you want to be involved, and that we can help be a bridge or connect you to resources that you're looking for. While we are an all volunteer group, I do believe that we are a volunteer group that are committed and invested into the success of our section as well as APHA as a whole. And so with that, I think that we're, again, it's been, I might be biased and others on this chat might be biased, but I think we are the best section because of that. So upcoming activities, as many of you may be aware, next week is National Public Health Week. It's usually, like every year, it's the first week in April. And this year, the theme is public health is where you are. And each day throughout the week is focused on a particular topic. And so as, thank you, Kelly, for putting in the chat, you can actually access and see, there's a National Public Health Week calendar that you can see all the events throughout the year. And then our group, which is most of our planning and programming is led by our student committee, and they put together a phenomenal program. They are still fine-tuning the links, but they have identified many activities throughout the week. As you can see here, for Monday, we'll focus on racism. We'll have various presenters talking about each of the various topics. Some of the items will be pre-recorded, and those links to those presentations will be shared on that given day. And then the live presentations, we're looking to have those links up over the weekend so that you can access. And then we're also going to make sure that we add those to adjust your microphone. Let me get louder. Sorry for that. And we unfortunately do not have closed caption today. Our membership service or Zoom account doesn't include the the closed captioning, and we'll be sure to include that in the next round. But I will try to speak louder. Sorry. I also have, I don't have necessarily my own workspace, so my wife is also working in the background, leading the same meeting together at the same time. That's just how it is during this time. But I will try to speak a little bit high pitched, as I know I'm a talker. But yes, we'll be, please stay tuned to the emails. We will be sure to share National Public Health Week events. You'll also see the link that you can actually register for our event taking place. I believe it's next Wednesday, if not Thursday. I can't mix the date with the day. But that is focused on mental health innovations for public health, which is led by our health communications work group. Tammy is our chair for that group and has been doing a phenomenal job this year. We already had a discussion early this year talking about public health entrepreneurship. And this is the second event in our series this year focused on mental health innovations for public health. And you can register for that again if you look at the link. Next up is we are, as you may also be aware, is that we are currently collecting abstracts for APHA. And so the meeting this year will be in Boston. While it is planned to be in person, I do think that there may be option for it to be hybrid like it was last year, but I do think there would it be in the 150th anniversary. We're looking to have it's a big event for APHA as a whole, and we want to make sure that we are participating in all the festivities and celebrating the great work of APHA over its 150 years of service. The theme is leading the path toward equity. And as you can see, the deadline to submit an abstract is April 30th at the end of the month, 11:59 Pacific time. So for those who are like me, I usually submit at 11:59 Eastern time, and then always relieved that it is Pacific time. But you can also looking for, if you want to be a reviewer, if you're looking to submit, to submit as well as to be a reviewer, you need to make sure you fill that out by April 30th. The links are in our chat right now. But pretty much for our section, I would say that we are one of the most cross-cutting sections when it comes to abstract submissions. There's a high pitch coming as I'm speaking. Got it. What if I, 1 second, I'm going to take a quick pause. Sorry for the technical difficulties. Hi, I'm back. Is my voice still high pitch or buzzing? Can somebody give me a thumbs up or thumbs down or chat notice? That's frustrating. What if I turn this off and I speak loud? Can you hear me now? Okay, I'm gonna do it like this. Oh, you said worse. Is that worse? I see mixed results. I'm gonna try like this for now. I might try to, can you hear me? How do I sound? Could folks say in the chat, just give me a quick poll. Okay, I'm gonna go like this for a while. I'm sorry for the technical difficulties. Okay, I'm gonna keep going. So yeah, with the event taking place, we are a cross-cutting section, and so many of our events cover various various activities. We try to again have a health equity framework in the abstracts that we try to review, and so we cover racism and discrimination, care coordination for vulnerable populations, organizing for justice, capacity building, a variety of topics in this area, and not limited to these areas either. Again, we are the cross section of advocacy and policy, and so things that fall under that view, many and various topics fall under that, from environment to healthcare services, to research. So that is the work that we do. There's also a link that you would see that if you want to see past a workshop that we did in the past year about the abstract review process. What is it that reviewers look for when reviewing abstracts and how to put together a good abstract? There's a YouTube video that's available that was previously shared in the chat. We'll be sharing the slide deck following today's meeting that you can click as well. APHA, another thing that we've been active this current year is the annual review of policies. This year there are over 19 policies that have been submitted so far. For those of you who are familiar with the policies submission process, you have those who are working early and go through the abstract, the policy review process, providing their drafts in the February, during the January, February months. Each section is responsible for reviewing the policies, providing section feedback. You may have seen communications earlier last month about looking for volunteers to help review abstracts. Our chair was pivotal in helping review the work that we do in those policies and gathering together. And so thank you to Ashley. So our policy review this year allowed us to have sorry, I know my audio kicked out. I'm back. We had over 19 policies again this year, covering 4 major topics focused on economics and international health, environmental and human rights, law, violence, prevention, and equity, and access to care, equity, and prevention. If you look at the color designations here, the greens were the ones that were given a positive review. Those in yellow were given, or gold were given, a conditional review, which often means that while there's general positivity with the general agreement with the policy and think that it's a good policy, there may need to be some updates to make sure that it reached a positive review. Sometimes it's some editorial work, sometimes some clarification, sometimes it's adding another some more context to the policy, but those are usually the reasons for that. And then we had those that are in red were the ones that were given a negative review. A negative review doesn't necessarily mean that we are not looking to that it can't get to positive. Usually, again, there may be some more structural issues with the policy. There's a framework that needs some more work, some further development. There may be some context that's not in there. And so the feedback that we give is to allow the authors of these policies to update. We provide some feedback and some suggestions, and then we'll do another review in the summer where we get to see if those updates were addressed, and then do another review process and see whether we want to support those policies. Sometimes we want to be sponsors of a policy and so forth. And so that's where we are now. If you're interested in learning more about the policy development process, please email us at chppdsection@gmail.com. That's where that general email is where we collect and triage all the inquiries for our section that we follow up with our leaders for each of those events. And so for Dr. Ashley Hickson is our policy chair, and she will help follow up with you at the given time. We are also looking for leaders for our section, and so there's 2 ways to do so. You can do it by either looking for an elected position, which is on this slide, and the next slide I'll talk about the other opportunities where you not necessarily have to go through elections, but you can volunteer, and we help navigate you to a opportunity that we think fits your skills and need and availability. For the elected positions, that's when you have to put in a nomination form. And thank you, Kelly, for putting that link in there. But we have a position available for chair-elect, which is my current role. We have secretary, 5 governing counselors, 2 section counselors, and 1 student liaison. Won't do this in order, but I'll say the governing counselors, for those who are familiar with APHA, each section has representatives that kind of operate like the House of Representatives of Congress. We vote on various policies and practices, such as the policy that you see that I talked about previously, that we vote to see whether we support or don't support those policies as a section. Individuals, we also vote on, like, for example, topics for the upcoming conference, governance for some of the for how CHPP, so governance for how APHA operates. And so we help with the rules and regulations to some degree of how APHA operates. So as a governing council, you come in and you serve as a representative for our section. Section counselors, that's more internal to our section, I would say, where you help fill in certain holes or opportunities, such as the leadership roles that we need to fill in. You're kind of, a jack of all trades to some degree. You're helping, step in. Like for example, today Kelly stepped in to help be our helper on this, monitoring the chat and helping with this webinar. So section counselors are instrumental in helping with being a bloodline to how this section operates. Secretary is traditional to, like most organizations. You are responsible for helping with the leadership notes and helping with the communication, broad communication and documentation of the work that the section is doing. The student liaison, again, in the name, helps represent the student members of our section. We also make sure that, not just being a representative for students, but also we give a lot of responsibilities to the students in our section. As I noted, they are responsible for leading National Public Health Week each year for our section. And then chair-elect, that role, again, is being to some degree the voice of our section. I've been a member of the section for 13 years, and this is my first time, or I was elected a couple years ago, so this is my second year as chair-elect. Kind of the chair position, it's almost like a 6-year position. You serve 2 years as the chair-elect, 2 years as a chair, and then 2 years as an immediate past chair, where you provide guidance to the current chair. So it's a great position. It's if you feel that you have time and want to and be a face for the section, it's a great opportunity to do so. So again, in the slide deck that Kelly shared, there's also a link in there which provides more information about each of these sections, the projected time it takes to for each of those roles, and just a brief description, and it gives us some feedback on the election process as well. If you're not fully comfortable with running for election, and again, each of those roles are elected positions, and so once you put in your nomination form and you clear to be elected, then it goes out to the broader membership, to you all, for those elections, and you'll see those ballots come out in the middle of the summer. So CHPPD committees, work groups, and chairs. As you can see, we have many things that are happening in this. Ebony noted earlier today, we do a lot of things. We do a lot of events, a lot of programs, and so we really look to volunteers from our section to help out with these activities. One is, membership committee. I used to be membership chair for this section, in which you just be a voice for the membership, helping understand what is it that members are looking to get from this section, helping connect folks. Policy committee, again, is helping with the policy reviews. Program committee is in charge of, in essence, the programming that takes place at the annual meeting. So we receive many abstracts and that we have to go through. We have to triage them. We have to make sure we give a thorough review process. We then have to figure out how we put them together for the conference, and that there's a certain theme. And so it's a whole, it's a lot of work, but it's a lot of fun work, to be honest, because you really learn to collaborate with other leaders within APHA, with the leaders within the section. You get familiar with the various policies and types of research folks are doing around the nation, because you are reviewing those type of policies. So it's very useful, and engaging activity. As Ebony noted earlier, our day of action, about 10 years, it might be 10 years now. We've been, the cities where the conference is taking place, we look to be, conduct an advocacy or community service activity in those communities. We've done various things such as advocating for expansion of Medicaid in New Orleans and in Louisiana. We helped at a community, last time we were in Boston, actually, we helped with the launch of a community health center in one of the communities in Boston. We've worked, we've been in San Francisco. We've help in help with the homeless shelter and so forth. We've done walking tours when thinking about the built environment and how we can better the environments in the communities that are in to make them more accessible for members. So we've done various activities. It really depends on the city and what the city is looking, the community leaders in those cities are looking to do. If you're interested again, you can reach out to CHPPD section at gmail.com to learn more about that. We'll connect you with Dr. Amy Carroll Scott, who's led these events for these many years and is actually looking for someone to help mentor, to help take the lead on this activity in the coming next year. Um, Again, the Health Communications Work Group, as I said, they put on webinars throughout the year on various topics for public health professionals. And so we do that on a regular basis. Uh, Something that we launched last year and looking to do again this year is a mid-year meeting. So separate from our town hall meeting that we're having today and the usual membership calls, we want to have a themed meeting for members who cannot necessarily make the conference but want to engage and have um, some learning opportunities. We try to do a mid-year meeting. I think our aim is to do so in early June. So don't quote the June 6th date, but that just gives you a target date of when we're looking to have an event focused on that, and we're looking to have a committee come together and help with the planning of that. Last year was a health equity framework, and we had 4 presenters talk about health equity from different perspectives. And then we also had a mental health break where we all did some yoga and some collective breathing exercises. COVID happening these past 2 years just to give us as a mental health break. And another new activity that we're looking to do this coming year is an archiving committee. Again, with the 150th taking place, we want to make sure we capture the history of our section throughout the years. And so if we're looking for various members who are interested in helping archive and capture the work that has happened in this section, we have various documents that need to be reviewed. We have we want to do some interviews with some senior members of our section just to gauge their perspective. So we're looking to have a mixed, a very elaborate group, some individuals who are familiar with using technology to help some of our folks who are not comfortable with technology to capture some information, maybe make some videos or some audio stuff. And we want to put together a nice little presentation for our social that's going to happen at the conference this year. And then, as you can see, again, we have various activities and we need help planning for the conference. So separate from the actual programming, with the scientific sessions and so forth, we usually have an annual social where folks can come together and celebrate the past year. We do awards during that time, so we need folks to help with nominating members who should receive awards, as well as facilitating the process. We talked about fundraising earlier. Yes, we will be sharing, and I see the question about recording. We'll be sharing the recording from this meeting, if not later this weekend, early next week. So please stay tuned for that. It'll come from the Zoom if you registered, as well as we'll be putting the link, sending a blast email from our Connect listserv. And then we have, again, other types of opportunities, community shares, and so forth. So as you can see, we have a lot of opportunities. If you're interested in any of these topics, please feel free, again, to email us at chppdsection@gmail.com, and we will relay you to the appropriate person who can help with. When you volunteer for these activities, you're not just thrown in and just so to lead and figure it out. We usually try to connect you with somebody who's done it, or we provide some tools and resources. So it's really just looking for volunteers who have the time and bandwidth to help with things, and then we can figure it out from there. So with that, we're now going to jump into another activity. We're going to now I know we have a bunch of people. This is the first time we've done this. We're going to try to use the whiteboard collaboratively to gather folks' perspectives on this question. And the question is, what do you think are the most important health policy issues we're facing today? So I'm about to stop with sharing this presentation. And I am going to open up a whiteboard that will pop up soon. Hold on a second. And type the question out live. Please ignore bad spelling. What do you think are the most use. Okay, if you are on your screen on the Zoom, if you move your mouse to the top, you will see a Kelly, can you remind me again what was the title of it? Is it I lost it. I think
Yeah,
it says
yeah.
you are screen, you can see the screen or some forth, and then you can see a tab where you can click it and it will say annotation.
Yeah, so what they're gonna have to do is they're gonna have to go to view
Kelly, if you don't
options.
mind chiming in and reminding me how we got there. But if you can get to the whiteboard yourself and you click annotate, you'll be able to then add your own thoughts to this question. Yep, I see somebody's gotten in there. And yeah, if you can type text, and then once you click enter or click out, then you'll see the various things. Look at that. You could try to do the draw function if you feel comfortable. I have a touch screen, so sometimes I try to use my finger and try draw it out myself. And if you join by phone, you may not be able to, you probably cannot participate with the whiteboard. Feel free to put it into the chat. Upstream determinants of health, funding for health and state health departments, universal health care. We actually passed a policy last year. In the past 2 years, honestly, there's been back-to-back pushes for more universal health care practices. Within the framework of COVID, and if we had a more universal system, we could have helped address some of the disparities that were happening. And another one is more from a macro perspective of catching up with the healthcare systems of other nations that we find out to be our peers. There are a lot of policies that are out there out of a health equity perspective. Housing. I do a lot of social determinant research, and the one thing that keeps coming over is that if you want to, you can't expect to really focus on health if you don't have adequate housing. That seems to be a essential need in the work that you need to accomplish those things. And I'm going to copy your comment over here so it's on the whiteboard. Thank you for sharing on the chat. Okay, some good thoughts here. Thank you for these. I'm going to hear and save this because we're going to use this honestly for later when we think about programming for the mid-year meeting. So gotcha. Got you participating without you knowing. So that was that question. Clear. Thank you all. Boom. We're going to do another one. The next question is, what do you think will be the most important public health issues we will be facing in the next 10 years? So similar, but not necessarily similar. Left that question mark, but I don't want to get back in there. Climate change, housing and climate. Add these into the board. Thank you, Anne, Navarre. Please excuse that beeping, as that is my other laptop from work reminding me to log out. Cost of living wage. Climate change seems to be a big one here. As you can see, as we are living today, see how that's going. Impacts of COVID, good one, yeah. Housing Water shortages. Thank you, Michelle. All right. Anything else to add before I click save here? Thank you all for participating there. Ooh. All right, let me stop this and go back to our slide deck. That actually worked out pretty well. That was the first time we've done this. And so kudos to us. All right, share. On. Share and desktop and share. Are you all seeing the slide deck again? All right. So as we are nearing, and we actually had this in, we're actually on schedule. So kudos to all of us. So important dates to note. Again, call for abstracts. You have until April 30th to submit your abstracts and or to be a reviewer for the abstract process. So please keep that in mind. So you have about 1 more month to go. Again, National Public Health Week is next week. So please stay tuned for the CHPPD links that we'll be sharing shortly. And you'll probably see them a comprehensive email over the weekend, and then each day we'll give you the link for that day. Nominations for leadership positions, again, are due next Wednesday. I believe the 6th is next Wednesday. So please, if you're interested in running for one of the positions, that being chair-elect, secretary, governing counselor, section counselor, or student liaison, please feel free. And again, if you need more information, feel free to email chppdsection@gmail.com. And then fundraising, we are always looking for, again, with the fundraising and for having an opportunity to have scholarships for those to attend the conference and participate in various activities throughout the year, including the policy summit that happens later on in later in the spring. We use our enrichment funds to help finance that type of work for our members. And so the donations that we give go back to us to do the type of work that we want to do to give back to our members to foster their professional development, particularly for our students and early professionals. Again, if you're using your phone, you can go ahead and use your QR code. The link again, thank you, Kelly, for sharing, is in the chat. And with that, please connect with us in various ways. I've said the Gmail account multiple times. I'm trying to get that into, just to see, that's again our central hub for collecting messages for all our leadership. But then we're also on, we are on Twitter, but we haven't been as active on that. But our Instagram is active, our LinkedIn is active, and then we have a YouTube page where events like today are posted. And so you can stay in touch if you are on YouTube and you like our channel or our page, you'll see the things that are shared or posted there. And with that, Ebony, are you still on? If you don't have any other closing words before we're going to close this part of the meeting, and we're going to stop recording, and then we're going to go into phase 2, which is the networking activity, where the plan is to we're going to have a shared event, and then with polls again, and then we're going to go into breakouts where folks can just connect and wrap, and we'll give a prompt for folks to do so, but we're going to stop the recording. This will just be for us. And so if you feel comfortable, please don't come back on camera at that point, and we're going to connect. But Ebony, please, any closing words for this part of the session?
Oh, no, thank you, Maurice. I just want to thank everybody again for your time.
You're not coming through, or maybe you are. That's just me. Ignore me.
Can everyone hear me? Okay, great. Thank you all again for your time. I hope the information that provided was very helpful. Again, our doors are always open. If you ever need anything or have any questions, please feel to reach out to us in our various capacities, whether it's email or through Twitter, Instagram, LinkedIn, we are available. I know earlier you asked about the April Fool's joke. So tomorrow is my birthday. So I'm actually celebrating today and all day tomorrow and all day Saturday. So I wish you guys a very happy weekend, a safe weekend. Please continue to use all of our precautions because COVID is still here and among us. I know we're not talking about it as much, but we're moving into a space now where we're managing this as a condition among others. So please just take your precautions, and I look forward to the networking opportunity. Thank you again.